Hello to all of my caregivers, families, affiliates, providers, etc. Quinchelle Gilbert. I am super excited to be back in the office. Just wanted to come and talk to you a little bit more about impact. Um, I am meeting so many people. Their situations and stories are so unique and different. And as much information and education as I can give to you, I absolutely want to be able to do that. Why? Because the more you know, the better equipped you are to make the best decision that you can for your household, which I 100% absolutely love. I want to talk about what happens when you enroll on Impact or in Impact Health Sharing and how that works. Um, when you enroll into Impact, you get to choose an annual household primary responsibility amount. So a PRA, that's known as a deductible, but in health sharing, it's called a PRA. And that's per household, it's not per person, which is great. So some of the PRA amounts is 2,500, 5,000, 7,500, and 10,000. And your annual PRA must be met before sharing begins, and it is achieved through eligible medical bills and impacts exclusive wellness rewards program. I talked about the wellness rewards program before. If you go to the gym, if you're taking supplements, if you're getting acupuncture, massages, just anything that helps take care of your body and make it better, uh, fuel it, etc. You send in those receipts every month, and they take a $150 off your PRA. So again, primary responsibility amount. Again, it's per household; it's not per person. So if your family of four has a PRA of 5,000 or 2,500 or something like that, then they deduct every single month for from your PRA. And if your family's practically healthy and you don't really go to the doctor a whole lot, then it comes in handy, right? And then the eligible medical bills. So there are some eligible bills, that medical bills that you can send in, and they'll also help take monies off your PRA. Not something that you're going to get from your traditional insurance company, which I've never been able to send anything to my insurance company and have them give me a thing off my deductible. Again, insurance company uses deductibles, and we do PRAs. That's what makes the difference. The other thing that I really like about Impact are the transparent guidelines and support. So they're going to tell you up front if they cover something, instead of having you get to an appointment and be surprised by something, which also is something that you want. You don't want to get to an appointment thinking that something's going to be covered, and only to find out that nothing's covered. And, or they're only covering, less than what you thought, and your out of pocket is whatever. So before you even go to an appointment, they have like a concierge service that you can call into and find out exactly if it's covered or if it's not covered. They're going to tell you prior to if you're utilizing the services. There aren't any universal rate increases. There hasn't been over the past 5 years, which has been great because that gives the members predictable costs. Insurance companies typically raise the rates. They don't, year after year, the rates go up. With health sharing, again, no universal rate increases over the past 5 years. And, that's a great thing. So they don't predict any rate increases, for this year, this coming year in 2026. And then, the other nice thing, there's so many great things about Impact. At some point, I'm probably going to get an Impact tattoo. I'm just kidding. I might. I don't know. I'm thinking about it. We'll see. But, the wellness rewards, the 24/7 telehealth that's available to you. They also have short-term teletherapy, and then annual wellness visits, annual routine labs, prescription savings, dental and vision savings, and a lot more. So that's something to just like really note. um I know I only go to the doctor, praise to God, um every year for my annual checkups, but outside of that I'm pretty healthy, and I don't have a need to go to the doctor for any other reason. um but that's not everybody's story. So if that's your story, then impact is something that's really good for you, something to really consider. And I'm saving money. Like, I don't even think about the cost that's coming out of what I'm paying every month for impact, because it's so much cheaper than what I was paying before when I had health insurance. I know when my family and I recovered on the health insurance, it was 1,800, $1,900, something like that. There were five of us on that insurance. So now, I'm paying 263 for me and my child. And that's because I got um I'm paying 263. My deductible is different. And, depending on what kind of deductible you're wanting determines, what you're going to be paying. So I just wanted to just tell you that. Oh, and I think I've mentioned this before, and I'm going to continue to mention it. You don't have to change your provider. I will be visiting, and I already have been visiting many providers' offices to give them some information about impact, so that they know that they pay those bills within 15 days of them receiving. The reimbursement goes out 15 days after they've received it. There's not one insurance company that can say that, which is pretty nice. So the more providers know about impact, the more we'll start taking it, and there won't be any question about if I'm going to get paid or not. Yeah, you're going to get paid, and not only are you going to get paid, but you're going to get paid within 15 days. So we have providers, we have a preferred provider link that the doctors can use to get signed up so that they can become preferred providers. The credentialing takes 30 minutes. And then as they start seeing patients, then they send in those bills again, 15 days. So those are some really nice benefits of being an impact customer. And actually kind of feels like an impact family, because again, health sharing is everybody contributing money into, the pot. And then as things are needed, what they do is they just deduct it from the pot. So every bill I pay, every month I pay my bill, and that's just going into it. And this is a nonprofit, so they're not incentivized to hold on to that money. So they're, constantly giving it out for one reason or another. One of my colleagues, she's like my sister, Sharon Lambie. Some of you may know her. They had something happen in their family, and all praises to God that her family member was covered under impact. Surgery, quick, 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 quick. No questions asked. Care, done, quick. And it was very nice to see that it worked that fast, just as they said it would, right? So every time you hear testimonies like that, then that just builds your confidence more and more. I'm not selling anything that I'm not using myself. And that goes for any part of my businesses. Like, I'm never going to get on here and recommend even a place for you to send your loved one to that I haven't vetted, visited, talked to the staff, talked to the residents that are there. Like, I'm never going to recommend something that I have not physically laid eyes on or that I don't have experience with. So just know that about me. I'm going to sell you something that I could tell you firsthand it works, it doesn't work, I like it, I don't like it. And, here's my experience with it. So happy to be able to do that. I am super excited to continue to educate you guys on impact. Again, this is something that's just going to take off. It is already taking off, and it's growing. And I don't want people to get left behind. I don't want people to not have coverage. I don't want them to feel like they can't go to a doctor or get their prescriptions or anything like that. Like, when you know better, you do better. So here I am bringing you education so that you guys have what you need and you're equipped to make it happen. So if you would like to sign up for Impact, The information is always going to be in the description. You guys have my email and phone number. If you have questions, call me. If you have questions, email me. I'm happy to get back to you and let you know exactly what needs to happen, who you need to talk to, etc. All right? Happy Wednesday, happy hump day, and next week's Christmas. So we'll, just all praises to God that we made it through the year. We're going to continue to make it through the rest of the year. And I'm going to every week have videos for you. I'm going to do better with the content because the education is the piece that people miss. I'm also creating a content library for you guys that's going to be located on my website. It's going to take me a little bit to do, but every time I make an upload into that library for you, I'll let you know. My website is anchorhealthsolutions.org. One of the partnerships that I talked to you about and that you'll continue to hear me talk about is the partnership that I have with Nurse on the Go, and Anchor on the Go, as well as LAMD, as well as we have partnerships with providers, nurse practitioners. We're about to partner with the pharmacy, etc. So the more resources that we can bring to you, the better. And everything that we're doing, we are literally trying to make it mobile and convenient for you so that, you're not having to leave the house or try to find someone to come get you, to take you, or anything like that. We're just really trying to make sure we're doing our part and being a big resource for the community. So visit my sister's website. It is nurseonthego.com. Go is spelled Geaux. So we also have Hydration on the Go, Geaux, that we're starting. So if you need IVs, vitamins, supplements, protein, weight loss, you name it, we got it. And even for some of the people that struggle, women that struggle with hormonal things, etc., longevity, just all kinds of stuff. Like we're out there. So if you need anything, give me a shout, give me a holler. You have my email, you have my phone number, as well as my website. And I will see you next week. Peace. And you guys have an amazing Christmas. I'm going to get on next week and just wish you a Merry Christmas. Be blessed. Put God before everything. Have faith in all that you are looking for. Faith is the substance of things hoped for and the evidence of things not seen. So faith is that one thing that you have to trust without knowing what the outcome is going to be. And that's faith in God, that regardless of what's happening, regardless of what you see, the outcome is going to be what it's supposed to be. A good end in the name of Jesus. Love you guys. I will see you next week. Peace.